The docs that have really taken to DAX have not only improved the number of patients that they're able to see every day, but their overall cognitive burden really seems to be less, to the point where, these docs have almost grown reliant on DAX being available to them in order to do their documentation, because it allows them to connect with their patients so much more effectively in the exam room. DAX is listening to the conversation, but then when they do step out of the room, there's still work that needs to be done either for that individual patient, or they're answering messages for other patients in between patients while the next patient's getting ready to be roomed. They're able to use their Dragon in addition to DAX in order to do some of those non-visit related activities, like our well child visits or some of the annual adult wellness visits, or even some of our procedure notes can still be very templated with some little pieces, bits and pieces that need to be filled in with the Dragon. So some of the docs for certain visit types will still kind of use their old, auto text templates and then use their Dragon to fill in some of the gaps instead of using DAX, because they feel like they're that much quicker. They're still using Dragon from time to time. So we're answering questions either from patients on the portal or just from phone calls that our office staff send to us. We can still use our Dragon. Some of the docs that are seeing patients in both the hospital setting and the ambulatory setting are still using both Dragon and DAX depending on the setting. And so they've really figured out ways to allow both of those technologies to really complement each other